You have so many responsibilities on your shoulders, but have you ever wondered what goes inside your shoulder so that you can carry so much? Let's understand today. Today we are talking about shoulder and the accessory joints of the human body. Now, commonly what we refer to shoulder joint, that is the main joint, like called glenohumeral joint. Glenohumeral joint, the name as it itself is descriptive, it shows it is formed by the combination of the two bones, that is glenoid cavity of the scapula and the head of the humerus bone. The articulation between these two parts of the different bones forms the main joint of the shoulder, that is the glenohumeral joint. Now this joint comes in the ball and socket type of arrangement. Ball and socket, like a ball fits into a cavity. This arrangement, it gives so much of the freedom of movement at this joint, because as you know, there are so many movements that needs to be done at the shoulder. You would be surprised to know that the shoulder joint is the most mobile joint of our body. You always have used it, but you have never noticed this thing, that there are so many movements like flexion, extension, rotation, internal rotation, external rotation, abduction, adduction, and the 360-degree circumduction that you can carry out on the shoulder joint. Now, this shoulder joint, since it comes in ball and socket type arrangement, this gives it the freedom to make so many movements. Also, since it is in a ball and socket type of arrangement, it tends to dislocate easily. So, a body has the inbuilt mechanism to avoid any such disruptions. So, for that, the whole joint is supported by some accessory structures, which are like muscles or tendons. Then there are ligaments, there is articular cartilage and the capsule of the joint, which prevents the movement of the head out of this cavity. But the poor shoulder, it does so much. It can't do everything all alone. So it needs help. So here comes the three friends of it to support it throughout all the movements. The first is, they are the accessory joints of the shoulders I'm talking about. They are the acromioclavicular joint. Acromioclavicular joint, as we call it AC joint, it is formed between the acromion process of the scapula and the clavicular bone. Clavicular bone, the collarbone, you know it this way. Acromioclavicular joint. Second is the sternoclavicular joint. Sternoclavicular joint is again an articulation which is formed between the sternum bone, the breastbone, and the clavicular bone, that is the collarbone. Now, third and interesting joint comes in the form of scapulothoracic joint. Now, what is this scapulothoracic joint? I call it an arrangement joint. This is actually a false joint or a pseudo joint, as we call it, because this is not a true joint. Like, there are no muscles and tendons to hold these two bones. Now, you would say, what are the thoracic bones? Like, they are the ribs, right? So, scapula, at the back of your shoulder, the scapula, the shoulder blade, you call it, that rests on the ribs like this. Now, this, it can move away. So, to hold it in place, there are various ligaments to keep it intact over the ribs during the various movements so that it doesn't get away from its place. That is how the scapulothoracic joint is formed between the scapula and the rib cage, and so that the scapula can glide over those ribs during the shoulder movement. That's all for the today's session. If you like the content, do like and comment below and subscribe for the channel for more such videos. And if you have any queries, please do let me know in the comments. Thank you.